can say that in this new job that the life gave you, have you been successful?
Very successful. Yes, very successful. During the time that I was having radiation treatments and that, I never stopped exercising. It was low. I rode my bike. I didn't ride hard, but I kept always riding. And I went for walks possibly 3 days I'd go for a walk, and then 4 days I'd go on the bicycle. And I'd trade back and forth. And low impact, but I always kept my heart moving.
Yeah, that kept you healthy.
And I can honestly say that since I've been done with my treatments, I've never even had a runny nose. I've never had a cold. I've never been sick at all. And I was completed in my treatment probably in October of 08, I think.
So it's a year and 3 months.
Yeah, and I haven't been sick, not a cold, nothing.
So that comparing with the conventional therapies, the treatment didn't make you sick.
It's very non-invasive. I mean, it wore me down during the treatment. From that day on, I grew, and I just got better and better. It's small increments, but it gets better and better and better. And every time I go in for another PET scan and I come up clean, they said, you're cancer-free. And I said, thank you very much. And I just praise God for that. I just say, you know what? That's another thing. You're going to wear out your pants because you're going to be on your knees. So be ready for that.
Yeah, but you know what? It's not just that. You did your research. Maybe you and your wife of the people who help you. You read the book of Elaine Day, and you were an informed patient. It's not that you went to the doctor and you accept whatever he told you.
No,
because I think this is a mistake. What can you say about
On the
that?
contrary, I wouldn't accept that, and I feel it's not fair that these doctors they've been gone to school to be surgeons, and that is their only type of
training.
Yes, their only type of training, and they don't know another way. And I think that they should allow other people to get a diagnosis somewhere else and have another way, to understand that there's different ways to treat this cancer, but that it's not just surgery.
But you just said something extremely important. The doctors have been trained with surgery and pharmaceuticals. Yes. So don't you think that the medical schools should allow to study hypothermia?
Certainly. Yeah, they should be able to educate people in the hypothermia just so that they understand that there is an alternative way. And then there's many ways, just because surgical method is the only one they study. They have to be open to other types of treatment. It has to do with insurance too. An insurance company will pay for the surgery as a one-time payment and they're done. And they're saying, well, we don't know if this is going to work. Well, is it that they want you to get better, or is it they want to just get done with their payments? And you wonder how the insurance companies feel about that.
But you said something before, you were in a dusty area, maybe the pollution, the food, the stress. So cancer takes a time to develop. And we cannot pretend to take a pill or a surgery and be well next day.
But you're not going to be well because you're not going to have the same type of quality of life that you had before. When they surgically remove something, especially your tongue, it's going to change your life. And when you get done with that treatment, how much you are going to enjoy your life? Not much.
Not much.
So
the quality of life.
Right now, I enjoy my life. And
I just wanted to mention, when you get back home, you go to our website, there is a video of a gentleman from the Napa Valley, so it's between where you live and Los Angeles. He's a singer, and he went through the same experience. They told him, we are going to make an open surgery on your throat and take everything, and he said, hey, I am a singer, this is my life, if you do that, I am practically dead. So he came here, and after whatever the treatment took, he didn't stop singing. He has a gig, and he's about your age. He has a beautiful voice. I want you to see it because and the background music that we put in the video is his own band, his own voice.
Oh, that's wonderful.
It's fantastic.
Yeah. Well, I would like to thank my wife for doing all the research that it took to get me here. And then I thank God for getting me through this and giving me the trust. And I just put my faith in Him, and He brought me through this. And out the other side, we're all getting better.
Yeah.
And I got a good relationship with God.
We realize, I mean, everybody knows that as important as early detection, the early treatment is.
Absolutely.
Yeah. Mr. Breckling, I thank you so much. It was a wonderful interview. You're a very warm and nice man. And we are so happy to see the patients coming back.
Well, thank you very much.
I just wanted to, thank you so much.
Thank you. Thank you.